Welcome again to the special webinar from Health Risk Screening on COVID-19 and people with IDD, Impact, Prevention, and Action. My name is Craig Escude. I am the president of Health Risk Screening. I am also a family physician. I'm a fellow of the American Academy of Family Physicians, as well as the recently formed American Academy of Developmental Medicine. Our program today was prepared in conjunction with the rest of our clinical advisory team, Sherry Neal, our clinical director, Deborah Davis, our client services manager, Dina Pizzuro-Smith, our director of client services, and the illustrious Karen Green McGowan, the founder of our company, the founder of Health Risk Screening. I want to say today that our focus is not to talk about well-known information about COVID-19. It's not to provide you with the latest number of cases or to update you on closures or cancellations or even how the stock market has dropped. But what our focus is today is to relate the impact of these events on people with IDD and their support teams and structures, and then also to provide you with some resources and actions that you can take to help mitigate these risks and these issues. We here at Health Risk Screening, as you probably know, are about identifying health risks, and then providing you with action steps and measures that you can take to help reduce health risks in people that you support. In talking about getting information, I do want to ask that you look for trusted resources when you're looking to get the latest information. Look at the Centers for Disease Control, the National Institute of Health, the World Health Organization, not to social media outlets to get the health information that you're looking for. Also look at other organizations that you've trusted before, and I have some of them listed here for you. Anchor, which stands for the American Network of Community Options and Resources at anchor.org, has a tremendous amount of information for providers of supports and services for people with disabilities. I would encourage you to visit their website. The Administration for Community Living at acl.gov has excellent resources as well. And you can go to their homepage and click on COVID-19 resources, and they have some excellent information that can be helpful. The American Academy of Developmental Medicine and Dentistry at AAIDD.org also has very helpful resources, particularly at AAIDD.org/prepare, and you can, again, you'll see this on their homepage. There's a list of resources about preparing for different types of scenarios and different types of circumstances that you might find yourself in. That information can be very helpful. The Developmental Disabilities Nurses Association at ddna.org also has helpful information, and there's a downloadable handout from them in today's presentation. And then the National Association of Direct Support Professionals at nadsp.org also has resources in particular that are geared towards direct support professionals and the challenges that they are facing right now during this time. If any of these organizations fit the work that you do, I would strongly encourage you to become members of these organizations as well. So we know that the risks of serious health effects for people who contract COVID-19, according to the CDC, people who are at greatest risk are people that are over age 65, people who have lung disorders, who have heart disease, immune deficiencies, and severe obesity. When we look at people with intellectual and developmental disabilities, there are some other things that we can think about, including people that have a decreased respiratory capacity, maybe because of the way their body is shaped or other issues, people who have asthma. We know that people with intellectual and developmental disabilities can be at an increased risk for episodes of pneumonia, particularly the aspiration episodes. They may have chronic silent aspiration. These types of conditions can cause scarring of the lungs over time. So people who have these risks are also at increased risk for severe illnesses from COVID-19. So those are some of the health risks, and there's a lot of health information out there. And I want to talk about some of the other risks as well. And that includes the risk of people losing supports. They may lose supports from family members or from support staff because they may become ill themselves. they might have an ill family member. They may have no child care. They may have a family that they need to care for and they weren't able to go to work. And those that are out working may become very overworked. Agencies are at risk. Some of them are losing operating funds. Some of them have been forced to close during this time. They may have difficulty keeping staff there. And there's concern that some of the services may not be able to return after an event such as this pandemic. So besides the health risks, people are at risk for losing some supports. And if they're not losing supports totally, they could also be at a risk of reduction of supports. I've seen briefings out there about support coordination and removing the requirement for face-to-face visits, that these visits can be occurring remotely. And there's a suspension in the requirement for community time in some places. And again, these are certainly reasonable measures and things that need to happen right now, but it can affect the way that oversight and management and activities and all types of things are being done. There might also be a reduction in the accessibility to healthcare providers as they're dealing with people who are infected and other issues, and also a greater risk of exposure in going to the healthcare provider or a hospital where there might be a number of people who have this virus. You know, again, we're identifying some of the risks here, some of the things that could be happening, and I want to try to offer you throughout this presentation some opportunities or some options that can help. When we're talking about reduction in access to healthcare, I want you to consider strongly using something like telemedicine. Telemedicine is not new; it has been around. And it can certainly give access to people and keep people from being exposed as well. It can give access to healthcare. The country knows this, and what they're doing is relaxing rules to facilitate the use of telehealth. The Department of Health and Human Services has expanded telehealth access. Medicare beneficiaries can receive a wider array of services. They can now utilize any non-public facing remote communication device, meaning your phone or your computer, as long as it's not facing the public. They have reduced or waived beneficiary cost sharing. And it's not limited to a specific diagnosis like COVID-19, meaning people can access and utilize these services for any healthcare visit. Now, the federal government has oversight over Medicare, but the states have oversight over Medicaid. So each state has broad flexibility about what's covered and what's not covered in terms of telemedicine and telehealth. So check with your local offices and your state offices. I've seen several states put information about reducing the or increasing the flexibility to use telemedicine. Anytime that you use any healthcare service, I would always recommend that you try to find a healthcare provider who has some degree of training or at least an understanding or experience in working with people with intellectual and developmental disabilities wherever it's possible. We know that unfortunately, not a lot of people are trained in this area. A lot of physicians, nurses, ancillary healthcare professionals all went to school and learned a lot, but not necessarily a lot about the particular aspect of providing healthcare for people with disabilities. One such organization that is providing telemedicine services that I want to mention to you is Station MD. They are trained using a curriculum developed here at Health Risk Screening to provide a basic health understanding of providing healthcare for people with intellectual and developmental disabilities. And I'm promoting them because I know that they have training, but I do want you to know that HRS does not receive any financial benefit from utilization of their services. I just think it's the right thing to do. So when we look at some other things that are happening in today's world, we look at social distancing, quarantining, and isolation. And you know, what do these things actually mean? Social distancing is basically avoiding close interaction to reduce contact and to reduce the spread of a particular disease. And that's something that most of us are pretty much all being asked to do right now. Quarantining has to do with people that have been exposed to a particular disease, and it's restricting their movement because they might be at risk of spreading it before they even have symptoms. Isolation is separating people who are ill from those that are not. So these are people that already have the disease that are being isolated to help prevent the spread that way. And again, we're all being asked to do social distancing. And so what does this mean? What does it look like? It means, especially for people with intellectual and developmental disabilities, visitations can be limited. People may not have access to their family and friends the way that they are used to having. No large crowds, so that can mean no work, no school, no social activities, no church. It can even mean eating in smaller groups or eating alone. And there can be some unwanted effects. We're talking about greater social isolation of a group of people that have been fighting this challenge for many years. And some of these unwanted effects can include increased anxiety, worry, and fear, loneliness, anger, boredom, and depression. And sometimes these things, especially in people who have a difficulty expressing themselves using words, this can lead to adverse behaviors, which can present additional challenges above and beyond what's already going on today. So when we look at social distancing, what can we do? Are there things that we can do to reduce some of these negative effects? Yeah, and there are some things that we can do. First, we can try to connect with others in different ways. We can use things like social media. That's a good place to use social media, is to keep in contact with others. Video conferencing, things like this software here, GoToMeeting software, or Zoom, or Skype. These are things that can be used to keep contact with other people in the outside world. And you might consider scheduling a regular time for people to be able to video conference with family members or friends. Don't forget about good old snail mail. Besides it being a way to connect with other people and stay in contact, it can also be a good activity for people to sit down together and maybe create cards or letters or artwork and then mail them to friends and family. Even an Xbox, if you have people that are interested in video games, these video game systems now have the ability to connect with other people and groups, so they can help keep people connected. There are also phone apps, things that are called House Party, Hangouts by Google. These are phone applications that can be utilized, that can facilitate group gatherings, kind of internet-related group gatherings. Look at relaxation techniques, things like yoga and exercise and meditation. These can also be helpful. In looking at other activities to do, many places now, museums and zoos, have virtual tours where you can go online, you can see the animals, you can see the artwork. So search for things like that as well. Journal writing, games, music, all of those are other activities that can be utilized to help keep people from becoming bored or just watching television all day. We do want to try to keep routines the same as much as possible. Things like cooking and cleaning and laundry and hygiene, all of these things should be continued, but you might be able to expand them. Maybe instead of cooking a simple quick meal, you can look at maybe cooking a meal that might be a little bit more involved, that might have some more steps to it, and everyone can participate in that a little bit more. SAMHSA, which is the Substance Abuse and Mental Health Services Administration, has a handout that talks about the behavioral component of social distancing and how people can be affected, and gives you tips on what to do. You can download this from the handouts section in your control panel, or you can go to samhsa.gov and look for that as well. I'm going to touch on some general preparedness items and general things that we should all be thinking about and doing right now in the areas that we work in and in supporting people with disabilities. And the first I want to say is to really monitor for signs and symptoms. We know what the signs and symptoms are. Again, the big ones are fever, cough, and shortness of breath. If you detect any of those things, notify your healthcare provider as soon as possible for directions on what to do. We want to ensure that people have an adequate supply of their medications. What's being recommended now is a 90-day supply. So look at your medication supplies, and if you're not if you don't have enough medication at this point for the people that you're supporting, then contact your clinician's offices to get refills. Also look at having a supply of the routine kind of cold medicines, the things that might be needed, such as acetaminophen or decongestants or cough suppressants or expectorants, things like that. Make sure you have an adequate supply of those on hand as well. Make sure you have usable thermometers and other equipment. Make sure the thermometers that you have in place work and that they're usable by people that you're supporting and that they can use them appropriately. You might even consider getting a home pulse oximeter. You can actually purchase these now for about $10 to $15 on the internet, and it can be a valuable tool. I will caution you that that you do need to make sure that if you're using a pulse oximeter, that the pulse accurately correlates with the person's pulse, because there are a lot of false positives on these, or false information can be given. So please ask nurses who you work with to help ensure that you're using it correctly. Utilize delivery services for groceries and other household items. You know, we can't go out like we used to be able to, but there are lots of delivery services out there now, and this can become an activity where the people in the home get together, go shopping online for what they need. The package comes, and we open up the packages and unpack things. So another type of activity to help occupy some time. Don't overuse personal protective equipment. We know that there is a big shortage right now. We want to be judicious. We want to use it when it's necessary, but for routine, for a group of people that do not have symptoms, it's not recommended at this time to use masks. Always, again, I refer you to the CDC for the most up-to-date recommendations on that, but judiciously use your personal protective equipment. You want to have a list of emergency contacts updated and available for all of the people that you support. This is a good time to call family and friends and make sure that you have the correct numbers and all of the correct information. Take a look in homes where you are supporting people and look for areas where a person might be quarantined if needed. You might choose one particular bedroom and preferably one particular bathroom that would be used by someone if they do need to be quarantined. If it's not possible to use to have a bathroom solely dedicated to that, you might or you should consider completely cleaning and sanitizing after every use. It's important that we all present a calm and controlled appearance and environment. Panic breeds panic. If we are in a state of fear, if we are anxious, if we are nervous, that's going to spread to other people around us. So we want to try to remain calm and again, keep a very calm and controlled environment. And if you have and are using a health passport, now is a great time to update it, or if not, you can create one. And a health passport is basically a document that has demographic information and basic medical information, which is kind of important. It's not a medical chart, but it has things like diagnoses and allergies and things like that. But what's really important in a health passport is that it has social and environmental information about the person as well. Things like, how does the person communicate? How do they express pain? How do they take medications the best way? Their mobility needs, things that can help them calm down. What are their likes? What are their dislikes? And one of the things that I really like about Health Passport is that it shows that people with intellectual and developmental disabilities are people first. And this is really important. It's very easy for people to not necessarily, how do I say this, value people with intellectual and developmental disabilities in the same manner that other people might be valued at the same level. And this document can help them to see them as people first. We have the Health Passport available for you as a download in the handout section of your control panel. Also, if you are a health risk screening tool user, and I know many of you are, a PDF version of this Health Passport will be available, should be available by the end of the day today in your knowledge base tab in the health risk screening tool. For each person that you support. So you can download this, complete it, and save it for that person, and that way you have it available. Here's an example of some of the questions. I didn't start with the medical part because you guys know all of that, but information about how you communicate. I use words and gesturing to indicate what I might need. I understand most of what people are asking of me. Under important social information, people describe me as being pretty smart at playing games. I make them laugh, and I'm really good. I make really good sandwiches. I like Wheel of Fortune and going outside on the front porch. And yeah, I do. So, but this is a way again to provide very helpful information to healthcare providers. If someone ends up in a hospital, this can be really helpful in having them know the person better. This particular Health Passport, as part of the HRST, also has a component where you should include the overall healthcare level if you are using the tool, and have and print out a the person's most recent scoring summary as well, and provide that to the healthcare providers, because as you know, there's a lot of valuable health information in the health risk screening tool as well. So going on to more general preparedness things, we should model good hygiene and model good cleanliness. If we want people to wash their hands, we should model that behavior. If we want people to clean and to keep things clean, we should model that behavior as well. People who work on the front lines with people with disabilities have one of their many responsibilities is to provide education and to teach people. At appropriate levels with appropriate levels of information, rather, and to teach them about good hygiene and good cleanliness and all of those things. And there's a document that was created by Green Mountain self-advocates that some of you may be aware of already. They created a booklet about COVID-19. It is written by people with disabilities for people with disabilities. This is available also as a download in your handout section, and we have it available in both English and Spanish versions. So feel free to download theirs as well, and you can also just search Green Mountain Self-Advocates booklet, and it will pop up on the internet also. But it's an excellent tool to help provide information to the people that you support. Other general preparedness items, utilize tools that you already have to try to identify who is at most risk. If you are using the health risk screening tool and are on our email list, you should have already received information about how to print out reports that can identify which people are at most risk for serious consequences from an infection such as COVID-19. Whenever possible, try to ensure that people maintain their usual routines, ensure access to medical care to the best of your ability. Again, consider telemedicine. Take care about what's watched on television, as some people may become overly anxious or agitated by what's seen on the news. So again, we want to provide helpful information, but we want to take care not to incite anxiousness or anxiety if we can avoid that at all. And again, stay informed about what's happening from very trusted and reliable resources. There are changing federal and state requirements almost on a daily basis, it seems. And I would encourage you to stay up to date on the regulatory changes regarding services that you provide in the types of setting that you provide, whether it be just a community-based home or an ICF. Because there are many things that are changing. Many of the requirements to provide certain levels or types of services are being amended or waived. But one thing that I would encourage you to do is to document any actions that you take where you change or reduce services away from the usual standards, so that you have information that can be provided as to why you made this change in the future. So anything that deviates from the norm or what's usually expected, I encourage you to document that thoroughly. In regards to staying updated, I mentioned to you earlier that we have a clinical advisory team. Yep, CAT for short. And we are working to create special bulletins, again, in particular about people with intellectual and developmental disabilities and how they might be affected by what's going on right now. We also have available on our website at hrstonline.com a free infection control video. This is a video that was created from one of our eLearn modules that's in the Fatal 5 Fundamentals eLearn series. We've taken out the knowledge check questions and the scenarios and kind of distilled it into a nuts and bolts video that you can use to train really anyone about infection control issues. We're going to have upcoming bulletins, and one of the topics that we're looking at is about the importance of communicating that people with IDD are people first. I'm hoping that we don't, but that we could come to a point where they're going to have to determine which people are allowed to get certain levels of health care, such as a ventilator. And we want to make sure that people with IDD are seen as people and they're not looked at on a lower tier. And we're also going to continue to do future webinars as things change and arise to keep you informed. We are in the process of working with AAIDD right now to co-sponsor a webinar that will be hopefully in early April. And so we ask that you, if you're interested in this, you can look for that on our website and in our newsletter. Now, I would be remiss as a physician, as a clinician, if I did not tell you to wash your hands. So when we're looking for some general prevention guidelines, remember to wash your hands for 20 seconds or so. Use hand sanitizers if you use them. They're recommending a hand sanitizer with at least 60% alcohol. Keep your hands away from your face, especially your eyes, your nose, and your mouth. Avoid close contact with others who are ill or infected. Stay home if you're ill. Cover your cough or your sneeze, and regularly clean and disinfect objects. This is very important because we know that the virus can live for hours and days on different surfaces. So regularly clean and disinfect objects like light switches and keyboards, cell phones, and eyeglasses, and all of those things. And we're doing this to try to slow down transmission. And why do we want to slow down transmission? Again, it's not so much to stop the disease completely, but it's to flatten the curve. You've seen this diagram already. If everyone gets this disease at once, it can overwhelm the healthcare capacity to help to manage it. And if we overwhelm the healthcare system's capacity, we will have more people that will have bad outcomes from this. If we can slow down the transmission, if we can spread out the number over a larger period of time, the people that have significant complications, then the healthcare system can better manage this, which can improve the overall outcomes. So I'm going to see here if we have a few questions that I can take. I'm looking at some of the questions now, and I'm seeing a few of them here. So there's a question that says, are there alternatives to testing for COVID-19 with a nasal swab? And at the time, I do not know of an alternative at the present time. Again, I would keep abreast with all of the other information that's out there from trusted resources, but the current testing, as I understand it now, is only available by using a nasal swab. Let's see. Let's see. Most of the other questions look like they're mostly technical questions, which is good. I will tell you that we will send out a recording of this webinar today as soon as this is over. We ask that you share this as much as you'd like with anyone that you'd like. We will have a link to the recording on the homepage of our website. You can visit hrscronline.com to sign up for our newsletter to keep abreast of other presentations and special bulletins that we'll put out. And I do want to be very respectful of everyone's time. We all have a lot of things to do. So this is the end of our talk today. Again, we will be having future talks, and any other questions that you have that we see here, we're going to use that information to develop future presentations. So on behalf of the clinical team here, all of us and all of us here at Health Risk Screening, we wish you good health and wellness, and we'll be in touch again soon. Thank you very much for joining us.